Hello everyone. So the topic that we are going to discuss about in today's video is gingival inflammation, and we are going to majorly see about the stages of gingivitis, which is a very commonly asked question. So let's get started. So before starting with the main topic, that is gingivitis, we are going to first brush up through the normal microscopic picture of gingiva. Why? Because it will help you to correlate between the normal and the abnormal. So over here, this is the gingival sulcus. So what is gingival sulcus? Gingival sulcus basically is nothing but it is a space which is present between the tooth and the gingiva, and this is the area where the dental plaques get accumulated. So dental plaque, it is the main etiological factor for gingivitis. So over here, this is the base of the gingival sulcus, and your plaque which is getting accumulated or attracted in this region of the gingival sulcus, it contains number of bacteria. So that bacteria, it will enter through this junctional epithelium into the connective tissue, which will progress towards the inflammation. So the next important structure which will lead to the inflammation is the gingival sulcus, and the next is the junctional epithelium. So junctional epithelium is the name as it is suggesting something, a junction between two things. So it is internally a junction between the tooth and the gingiva, whereas over here externally it is the junction between the gingival epithelium and the connective tissue. And this junctional epithelium, it contains number of spaces through which the bacteria, it gets progressed towards the connective tissue. So this is the connective tissue. Over here there are these gingival fibers which are present. The next epithelium is the sulcular epithelium. So as the name says, it is the epithelium which is lining the gingival sulcus. The next epithelium is the oral epithelium. So oral epithelium, it lines the oral tissues. So this is like just the normal microscopic picture of gingiva, and the main two structure that leads to inflammation is gingival sulcus and the junctional epithelium. What do you mean by gingivitis? So gingivitis is nothing but it is the inflammation of gingiva. So whenever you have this suffix itis, itis means inflammation, gingivi is gingiva. So the inflammation of gingiva is gingivitis. But now this definition is a very vague one. So because of that only, the American Academy of Periodontology, they defined gingivitis as it is the inflammation which is confined to the tissues of marginal gingiva. Now over here, this is the macroscopic picture of normal gingiva. You have this three parts, that is the marginal gingiva. Now as the name says, the gingiva which is present at the margin of your tooth. Then you have attached gingiva and interdental gingiva. So according to AAP, gingivitis is when the inflammation is confined to this marginal gingiva only. Whereas if it is progressing towards the attached gingiva, that means it will be progressed into the periodontitis, and it is no longer just gingivitis. Now, what is the main etiological factor for gingivitis? So as I said, the main etiological factor for gingivitis is dental plaque. So dental plaque, it contains number of toxins, number of bacteria, which through this gingival sulcus, it will enter into the connective tissue with the help of this junctional epithelium, as we have said about it in the last part of it, that is the microscopic picture, and that will lead to the inflammation of gingivitis. Though there are various multiple reasons for gingivitis, but the main causative factor, if we are saying, is dental plaque. So Page and Schroeder, they give this classification of gingivitis, or how the gingivitis, it gets progressed in 1976, and they have classified it into 4 stages. So the first stage is the initial lesion, next is the early lesion, the third stage is the established lesion, and the fourth stage is the advanced lesion, in which you will see there is the bone loss. So over here in these 3 lesions, you can see the bone is intact and there is no loss of the bone, whereas in the advanced lesion there is bone loss. And due to that only, so the first 3 lesions, they are known as gingivitis, where the inflammation is confined towards the gingiva only, whereas the advanced lesion, it is considered clinically as periodontitis. Why? Because in this the inflammation is progressing towards the supporting structures also. Now we are going to see each stage in depth. Gingivitis, it starts with plaque accumulation. So this plaque, it contains bacteria. So this bacteria and their toxins from the gingival sulcus, it will penetrate through the intercellular area which are present in the junctional epithelium to enter the connective tissue, and that will lead to the beginning of the inflammation, which starts in 2 to 4 days of plaque accumulation, and this is known as the initial lesion, that is your stage 1. Now this bacteria which are present in plaque, they have the capability of stimulating certain products which are known as collagenase, protease, endotoxins, and they are capable of damaging the connective tissue and the epithelial cells. So now what happens in the body because of the host response is the bacteria, it will activate the inflammatory process. So this inflammatory process is activated via the activation of the neutrophils. So your bacteria, it will activate the first line of defense cells, that are your neutrophils. So the neutrophils are activated and they will produce certain vasoactive substances which are known as interferons, TNF, interleukin 1, and because of the activation of this neutrophils, the vasoactive substances that are released will lead to the dilation of the capillaries. So these are your blood capillaries which are present in the connective tissue. Now because of these vasoactive substances which are released by the neutrophils, the capillaries are dilated. So because of this dilation of the capillaries, the blood flow is increased. So the first manifestation that you will see is dilated capillaries and increased blood flow in stage 1. Now the next manifestation will be because of this vasoactive substance, the vascular permeability is also increased. Now this vascular permeability is increased, so it will lead to the escape of the plasma which is present, and this plasma fluid, it also contains protein. So this is nothing but exudate. So this exudate, it will escape out via the sulcus as GCF. Now the clinical picture in this stage 1 will be exudation of GCF. So till now what we have seen is the vascular changes and the exudation of GCF as the clinical picture of it. Now the next manifestation that you will see in this stage 1 will be the neutrophils, they are adhered towards the vessel walls. So this is nothing but the adherence or the margination of the neutrophils towards the vessel wall. And after this, the neutrophils, they will escape out of the capillaries via a process which is known as dipedasis. So this is the process in which the neutrophils, they are escaping out of the capillaries towards the connective tissue. So what happens is the neutrophils, it will migrate to the area of insult and they will accumulate in the connective tissue just below the junctional epithelium. So this is the accumulation of the neutrophils in the connective tissue. Now what your neutrophil does? So neutrophil, it releases certain chemicals. Why? So as to kill the bacteria. But now when these chemicals are released, so with the killing of the bacteria, certain normal structures are also destroyed. So in this you will also see there is loss of perivascular collagen, and this perivascular loss of collagen will be, or it is a consequence of the release of certain chemotactic and antigenic substances. So the clinical manifestation in this stage 1 is exudation of GCF. The next thing that you will see microscopically will be the leukocytes are present. So in this stage 1, the predominant cells which are seen are your leukocyte. There will be loss of collagen, and as the plasma fluid is escaped out, so there will be serum proteins which are present in stage 1. So this is just a recap of your stage 1, that is your initial lesion. It gets started in 2 to 4 days. Now the vascular changes that you will see is classical vasculitis. Then there are dilated capillaries because of the vasoactive substances, and because of the dilatation, the blood flow is increased. Now microscopically what you will see is, now first thing that you will see is there is presence of leukocyte. So the predominant cell in stage 1 are your leukocyte, that are your first cell of defense. Then there is loss of perivascular collagen because of the activity of this bacteria and leukocyte. Then there is presence of serum protein because of the exudate. So the plasma fluid is like escaped out and it contains protein, so there is presence of serum protein. Now clinical changes are, so you will see exudation of fluid from the gingival sulcus. Now this stage 1, it is known as subclinical gingivitis. Why? Because as such you won't see any prominent or major like clinical feature in gingivitis. It is just the exudation of the fluid from the sulcus. So the initial lesion, it may resolve rapidly with treatment, but if treatment is not given at that particular time, so it may evolve in chronic inflammatory lesion that leads to the start of the next stage, that is the stage 2 early lesion, which starts in 4 to 7 days of plaque accumulation. Now the major sign that you will see in this particular stage will be bleeding on probing. Now there's this very commonly asked NEET MDS question, that is, which is the first clinical sign that you will see in gingivitis. Now in options you will also have exudation of GCF and also you will have bleeding on probing. Now many will think that in stage 1 we have seen that there is exudation of GCF, so that will be the first clinical sign, but no, the answer to this question will be bleeding on probing. So the answer to first clinical sign of gingivitis will be bleeding on probing. Now why? Because exudation of GCF, it is not very easily seen clinically, whereas you can see very easily bleeding on probing. So when you are moving your probe through this marginal gingiva, if you see bleeding, so that means it is the first sign of gingivitis. Now in this, as we have said that it is a chronic inflammatory lesion. So in this, the next line of defense cells will come in picture. So those are nothing but your T lymphocyte. So the predominant cells in this stage 2 will be T lymphocyte, that are like 75% of the total amount of cells which are present in this stage 2. So in this there are these T lymphocytes which are present, and also there will be macrophages which are present. Now apart from vasodilation of the vessels which are caused by this lymphocytes and macrophages, so this lymphocytes and macrophages, they will also produce growth factors, and this growth factor, they help in angiogenesis. So angiogenesis is nothing but development of new vessels and further proliferation of the capillaries. Now the next event that you will see in this particular stage 2 will be, now as we have said, what your inflammatory cells do, they try to kill the bacteria. So they try to destroy the bacteria by engulfing them through the process which is known as phagocytosis. So when they are doing so, because of the release of the chemical, so when they are trying to kill the bacteria, they will release certain chemicals, and because of that they will also destroy certain good or the normal structures, and because of this the collagen is damaged. So in this stage 2, almost 70% of collagen is damaged, and the major fibers are the dentogingival and the circular fibers which are damaged. Now the next manifestation of this particular stage will be proliferation of the junctional epithelium. So this is the proliferation of junctional epithelium, that are nothing but the reta-ridges. So reta-ridges are nothing but the finger-like projections which are formed to fill the gaps which are created by the destruction of the collagen fiber. Now what we have said earlier is, in this 70% of your collagen fiber is destroyed because of the activity of your inflammatory cells. And now as your collagen fibers are destroyed, so over here the space are created. So what your epithelium does is, it will try to fill this particular gaps which are created by forming this finger like projections which are known as reta-ridges. So this inflammation, it may trigger the proliferation of the junctional epithelium, which starts to show the development of reta-ridges. Now the next thing in this will be, there will be pathologic alteration of the fibroblast, and that will lead to decreased capacity for collagen production. Now in this, the collagen is also destroyed, whereas the fibroblasts are also getting hampered, because of which the collagen, it is not produced properly. So this is about the stage 2, that is your early lesion, which starts in 4 to 7 days. So again, a quick recap of the stage 2 will be vascular changes will be, there will be angiogenesis, that is nothing but the vascular proliferation. Microscopically, you will see there are the retapegs which are formed in the junctional epithelium. The cells which are present are the lymphocytes. Then the collagen is lost, is increased. Then the fibroblast, this show cytoplasmic alteration, due to which the capacity of collagen production is reduced. Then the clinical changes will be, there will be bleeding on probing, the first sign of gingivitis, and there will be erythematous gingiva. Now whenever you are seeing about inflammation, so inflammation, it will show the cardinal signs of inflammation, in which there will be tenderness, there will be redness. So because of that, the gingiva will be appeared erythematous. So this is the clinical picture for the stage 2, that is the early lesion. So stage 2, it will get progressed into stage 3, which is known as established lesion, which occurs 14 to 21 days after the plaque accumulation. Now in this, till now what we have seen were, there were changes which are persistent inflammation was there, then there was vasodilation, and there was also plasma protein leak, and because of all of these changes, the viscosity of blood is increased, and due to the increase in the viscosity, the blood flow, it is slow and stagnant, and because of this slow and stagnant blood flow, the gingiva, it gets a bluish hue. So this bluish hue is over here, so this is the blue color or discoloration that you see on the gingiva. So this bluish hue is because of the sluggish blood flow, which may cause deficiency of oxygen in the blood. The next thing that you will see in stage 3 is the RBCs, they escape to the connective tissue from the capillaries, and when the RBCs, they are escaped into the connective tissue, the hemoglobin, it is broken down into pigments, which further reddens the gingiva. So the clinical picture in this stage 3 will be, you will see that the gingiva is more reddish, or the color is more reddened, and also you will see a bluish hue or discoloration of the gingiva. Now the cells which are seen predominantly in stage 3 will be plasma cell and B lymphocytes. So the B lymphocyte cells that are found are predominantly of immunoglobulin G1 and G3 subclasses. Again, this is the next MCQ which is commonly asked, like which are the subclasses of immunoglobulin which are present in the stage 3 for the B cells. So that is G1 and G3. Now over here, the plasma cells, they invade the connective tissue not only immediately below this junctional epithelium, but over here you will see that this plasma cells, they will invade deep into the connective tissue around the blood vessels and the collagen fiber. Now in this stage 3, you will also see that the junctional epithelium, it will widen more, so it is proliferated more rather than what you are seeing in stage 2. So stage 3 is basically a step ahead of stage 2. So in this, the intercellular spaces, they are filled with certain granular substances or debris which are known as lysosomes. So over here in this junctional epithelium, you will see that there are lysosomes which are present. So this lysosomes, they contain acid hydrolases that destroys the tissue component. So in this, you will see there is this inverse relationship of the number of collagen and the number of cells. So if the number of cells are more, so the collagen which are present in this particular stage will be less. So stage 3 is nothing but it is a stage ahead of stage 2. So the proliferation is more deepened. The collagen fibers, they are more lost. So this is the changes that you will see in stage 3, that is the established lesion. So in brief about the stage 3, that is the established lesion, is it is seen 14 to 21 days after the plaque accumulation. The vascular changes, they are same as the early lesion, but in this there is blood stasis. That means the flow of the blood, it is slow and stagnant as we have seen. The microscopic changes will be there is proliferation, apical margination and lateral extension of the junctional epithelium. So as I said, your proliferation of the junctional epithelium, it is deepened more. Then there are atropic areas which are seen in this particular stage. The plasma cells, the predominant cells which are seen in stage 3 is plasma cells. Then there is further loss of the collagen because of the activity of the cells, inflammatory cells, and their activity of releasing the chemicals. Then as we have seen that there is lysosomes which are present, because of that the hydrolysis, acid hydrolysis are seen. So because of this there is increased enzyme levels of acid and alkaline phosphatase. So in this you will see that the phosphatase levels are also increased in stage 3. Clinically you will see that there are changes in the color, surface texture, consistency, everything. So the normal structure is changing in this particular stage. Then there is bluish hue which is seen around the reddened gingiva. Then gingiva, it appears to be moderately or severely inflamed. Now this established lesion, in some it may remain stable for months or years, so it won't progress into periodontitis. But in some people it may be more active and it may convert to periodontitis or stage 4. So stage 4 is like the formation of the pocket, or it is clinically seen as periodontitis, which is given the name the advanced lesion. So now in this you will see there is bone loss. So the plasma cells, again they are going to increase more and more in number. So the plasma cells, they continue to predominate, although the loss of the alveolar bone, PDL, is seen, and there is disruption of the tissue architecture with fibrosis. So these are like the main like classical characteristics which you see in stage 4, and in this there will be periodontal breakdown. So everything is, so stage 4 is the advanced lesion. In vascular changes you will see that it is same as the established and the early lesion, but in this there will be invasion of the lesion to the bone. So till now, till stage 3, bone was not involved, whereas in stage 4 bone is involved, the alveolar bone is involved. Now microscopically you will see there is persistence of the features same as that of your established lesion, but now in this the inflammation, it is going more into the deeper structures which is involving the PDL and the alveolar bone. Then there is presence of all types of inflammatory cells, and in this as the bone is involved, so in this bone is also involved, so there is conversion of the bone marrow into the fibrous tissue, and clinically you will see there is formation of the periodontal pocket and its associated changes. So stage 4 is clinically manifested as periodontitis. Until stage 3 it is known as gingivitis. So this was all about the stages of gingivitis. I hope you found this video helpful, and if you did then please like, comment, share and do subscribe to my channel. Thank you so much.